Hello and welcome back to Facts in the Future of Healthcare podcast. My name is Zach, and today we're going to be talking about steps we can take to move towards nationalized and universal healthcare. Isaac, you're up.
Universal healthcare is not something we can instantly go towards. There's a few steps that we need to take as individual countries, and then a global step. So we feel that the best way to normalize healthcare like this would be to start with a nationalized option, and that would mean passing a bill. To tell us more about how that might happen, Zach, go ahead.
Well, in the US, the first thing that we would have to do, the last step of the process to getting nationalized healthcare would be getting a bill to pass through the House and the Senate saying that, well, now the United States has nationalized healthcare. And once even a bill like that is drafted, what will we need to push that through? Well, you, of course, need the president's signature. You need you need votes in Congress, 2/3 majority, and you would need, and then first, before any of that, you would need someone to propose this bill and get people to back it. So how do we do that, Charles?
Yeah, so the main thing here is that while we don't have a perfectly representative democracy, our democracy and our representatives rely on reflecting what the people want, at least in theory. And so the first step really there is for people to want nationalized healthcare. So for this to happen, while there isn't an even party split, we will need bipartisan support to convince people to support such a proposed bill. And just for some context on how far we are along already in this, in a 2020 survey, 63% of people agreed with some form of the government being responsible for healthcare that is some mix of single national government payer plan and a mix of government and private providers. And only 37 people said that the government was not responsible at all, out of which only 6% didn't want any government involvement of any kind, meaning canceling Medicare and Medicaid that we currently have. And there were relatively similar numbers in 2019, not the exact same. But something really interesting here is that in 2020, at least, 34% and only 34% of people who lean Republican said that the government was responsible in any form, and 66% disagreed with that, whereas 88% of Democrats agreed and 12% disagreed. And so from this data, it's pretty clear, and this was rather intuitive, but it's nice to have it backed up with data, that people who lean Republican, and I say lean because people have many ideological backings that the two-party system often doesn't represent. People who lean Republican are the ones that need convincing here. So we really need to just convince that sector of the people, and if that sector of the people is very adamant that they want this, representatives will see that reflected and move towards steps to pass it in fear of losing their job if they don't reflect what the people want. Brendan, can you explain some of the steps that you can do as an individual person to further this goal?
So, Charles, the things you can do to help this future bill pass is convince your friends to at least think about or consider voting for this bill. You can register yourself and make sure your family is registered to vote. You can call or write to your representatives. You can share your beliefs on social media. You can even go to protests or vote for politicians that are working towards universal health care. These are the big 6 ways you can help with our cause. And Isaac, do we have any closing remarks?
Thanks, Brandon. You made that really clear on how an everyday Joe can help out this movement. We'd like to thank you all for listening to this series, and we hope it was impactful and you might share the same views we do. Thank you for listening. It's been Facts in the Future of Healthcare. Bye.